everyone, I have this very generous lady with me. Generous because she's been waiting, also patient because waiting since a long time for a local anesthetic procedure. Now the local anesthetic procedure that she's scheduled to undergo is blepharoplasty. For her, in her case, it's a lower eyelid blepharoplasty, bilateral, meaning both sides. I say lower eyelid because in case you just keep your face at rest, ma'am, we can notice the trough lines, which is the grooving below the eyes, and also the sagginess, the baggy eyelids on both the eyes, and also the puffiness. This typically happens with age as the tissues tend to weigh down. There is laxity of our muscles, and also there is some fat deposition which is unwanted. This sometimes worsens, sometimes is genetic, sometimes happens because of weight gain and loss, but there can be no particular reason attributed to the cause of under eye bags or under eye sagginess. But yes, a treatment does lie, and the surgical treatment, permanent treatment, lies in the form of something called as blepharoplasty. In this case, it will be lower eyelid blepharoplasty, mainly aiming at the unwanted fat deposition, going at the subcutaneous level, and also sort of a pexy of the muscles in and around the infraorbital and the mid-face region. So it's going to be this for this lady, and we'll also show pre and post-operative comparison. Maybe the immediate post-operative comparison would be better to evaluate because that would be minus any immediate swelling. Obviously, the recovery takes time, courtesy the swelling which happens, courtesy the ecchymosis which takes place. Slowly the body physiology takes up its own way and heals on its own. So we'll see how this goes. You have something to say, ma'am?
Yeah, this matter. It will take around 6 weeks or 4 weeks to disappear all this.
The stitches will take it out, ma'am. But the entire swelling is taking out on a 6th or 7th day. The swelling, let's see, ma'am, as to how much it comes to you. For every patient, it's different. For some patients, it's very minimal. Some patients, it's accentuated. Some patients, it goes away on its own in 2 weeks minus any treatment. So yeah, so for a good recovery period, anything we say 3 to 4 weeks. Yeah, for on an average, every patient. So yeah, so 4 weeks is 1 month.
Is it painful?
Yes, this is a very common question and a valid question from a patient's point of view. The only pain which you will feel will be the local anesthetic injection.
Xylocaine,
we give lignocaine and adrenaline mixture on both the sides, and also since the IV line is secured, we keep giving analgesics. So we give one, say, half an hour prior to the procedure and also post-op, so that the analgesic coverage is maintained apart from the local anesthesia that we are injecting. So the prick for the local anesthesia, yes, it's something which you will feel. Apart from that, everything will become numb. You will sense all of us around you because it's not general anesthesia, but apart from that, not very painful. But yes, you have to keep your body still and face still because it's very fine plastic surgery work. Okay? Okay.
So much. Thank you so much.
Thank you.
Don't do anything, just relax like that, just the way you are. So this is immediately after we've done a lower eyelid blepharoplasty. We're going to show you how the patient looked before. So you can see the eye bags that were causing this fullness. We've removed that, not excessively but just adequately. We're going to show you what all was removed. So that's the skin and the fat pad. Okay, and similarly on the other side, skin and the fat. Right. Incision. You can probably see some sutures now. Just very close to the lower eyelid. Steri strips. It's fine. Yeah. So we need to take the sutures off today.
Taken.
All removed?
Is there anything left over?
Okay, that's why it's looking like that. Yeah, you need to clean up a little bit on this area and all this, like a little bit. Where was it? You removed it that theater, that chair. Was it here only? Okay. We'll just clean it a little bit in this side, especially. This side is fine, and let it heal well. And then again, you can come after maybe a month or 3 weeks, something like that. Show me that. No.
You take now?
There's still swelling, but it should come down and it should look much better. All right.
This side, no? A little bit more.
Yeah,
More on
there's
this
a
side.
little bit
This
there.
is okay, like.
I think both should be fine. It will take a while because see the fat pad was also removed and I've removed skin. It will take some time. It will settle down.
Like 2 months, 3 months?
Yeah, maybe less than that. I think.
This scar will go, no? This
Yeah, it won't be visible.
it won't be.
No. Otherwise, just give her mupirocin. Applied already.
Yeah.
Then you can come maybe after a week
Oh,
if you're free.
fine.
We quickly check the scar and Vitadam also can be given. But it should not go into the eyes.
Yeah,
Vitadam should be only applied
yeah. Yeah.
outside.
So this line will disappear, right?
It will go away. You will not get to see any scar later on. Sure. That is 100%.
Right.
This is just 6 days. 6th day today, right?
Today is 7th, right?
7th or 6th? 6th day. Yeah, today is Monday. Done. I'll see you then again after a week, let's say.
Fine.
Come over just. I'm not there next week, I think on Monday, Tuesdays.
When you get back.
25th I'm back.
Okay.
So come out after that. Yeah, come 26 or 26, 27. On the Marivanga. Alright? Bye bye.
Bye then. Thank you for making me young.
You're welcome. Pleasure.
Okay, I'll come and see.